Well, hello, I'm Adam Biuckians. I am a child and adolescent psychiatrist, and I'm also the medical director at Community Services Group.
So, Dr. Biuckians, describe what a typical day would look like for you before the COVID-19 pandemic.
I generally work 10 hours a day. I start early in the morning around 7:30 or 8. I primarily see children and adolescents up to age 18. I do have a handful of adults that I see. And just as a way of, education as to what a child and adolescent psychiatrist does, we are doctors that specialize in children's emotional and behavioral health. And so a lot of what our job is to help kids who are having difficulties in regulating their mood, in regulating their behavior, and left unchecked, oftentimes it can grow into bigger and bigger mental health issues. My day was generally seeing about 20 to 25 patients a day.
And how has COVID-19 affected your ability to see those patients?
So it turns out I actually continue to see or contact patients at about the same number. So my schedule in that regard isn't really different. Really what's different is how I'm actually communicating with or seeing my patients. For the last 4 months, essentially, there has been minimal to no in-person interaction with our patients. We've done everything virtually, either through video conferencing like this, or for patients that don't have access or good access to internet and video chat just isn't working, we'll just do it the old-fashioned telephone way.
Hello there. So it's about 8 o'clock in the morning, and I'm about to get ready for seeing patients today. Well, I click on join the Google Meet. It gets you can see it there on the screen there. It gets me into the virtual meeting room, and then I just wait for my patient to show up. So I'll share with you that the appointment went very well, went smoothly, no hitches. That's not always the case. Oftentimes there are technological issues with slow internet that makes the video conferencing very choppy, and sometimes the audio goes in and out. So there are glitches that occur. Sometimes we actually have to either abandon the video or actually use the telephone in addition to the video in order to make appointments happen. There are definitely limitations to telehealth, and I don't think that telehealth would ever completely replace in-person visits. But that said, I do think that telehealth has a bigger role to play in the normal day-to-day service delivery of what we do when this whole pandemic is over.
So I understand that this pandemic has really pushed telehealth forward. What have you discovered about it?
I think generally the field is experiencing that the benefit of telehealth is that we have an ability now to maintain connections with patients who, specifically those that may have challenges getting to the office. Transportation can be a huge barrier for a lot of people. Sometimes, patients have a certain resistance to coming to the office, whether it be, severe anxiety or just kind of a hesitance, or it's easier for them to get on a video chat. It feels safer to them. They're in their home environment, that kind of thing. And so I think we're able to reach a broader audience.
Do you have concerns about children and even adults and our ability to handle all the uncertainty that this pandemic has created?
I think across the board, that uncertainty naturally creates a lot of anxiety. And the longer that goes on, that anxiety, that stress, that kind of not knowing, we do know that puts people at more risk for having longer term mental health issues, anxiety disorders or depressive disorders. And so I guess that would be one of my main concerns, is that the longer that this goes on, I think we are going to see more mental health issues arise because of this whole coronavirus pandemic, and accessibility is going to be more of an issue because we were already struggling to meet the demand prior to this. So I see that as a potential problem on the horizon that we're going to have to address.
I think my final question would be, how do you think we'll all get through this time?
I guess one of the things that I hope will happen is that we have an appreciation of how good things were, and that in order to get back to that, we all have a responsibility to do what we need to do to make sure we keep everybody safe. Things like wearing a face mask to protect others, and doing your best to keep your social distance to protect others. That's how we're going to get through this.